Hey guys, so just a couple quick updates on what I've been playing around with. Let me share my screen. Okay, so I've got a whole bunch of sample test cases. I can share this with you guys because none of these are real patients. They're just made up cases, but I'm using the same recordings for multiple trials to see what's going to work best. And something that I realized uh, we can create a template that has multiple versions of things in multiple areas and just pick and choose what we want to put into the EMR. So, like, for example, here for the assessment, I created an assessment where I reference the APTA guide to physical therapy practice, preferred practice pattern E. And within that information, it says APTA provides us with this information. It says over the course of 2 to 4 months, patient client will demonstrate optimal joint mobility, blah, blah, blah. Episode of care ranges between 6 to 24 visits. It says it's anticipated that 80% of patients who are classified as this pattern will achieve anticipated goals within 6 to 24 visits. So if my plan of care is within that expected range, obviously I've got clinical justification from sources far greater than me to indicate that this is what would be within reasonable and necessary. Um, Other things that I'm playing around with my goal structure. So my goals used to be very basic, very simple. Now what I did was I used the SMART goal framework, SMART, and I just asked the AI to take my goal, turn it into a SMART goal framework so I can kind of pick and choose, pulling elements from functional outcome measures. So this list of items comes from the upper extremity functional scale. Uh, there's lots of things that we can play with and incorporate into the templates. The other night I mentioned that I'm making templates for, shoulder pain, elbow pain, wrist pain, knee pain, hip pain, ankle pain. But then I'm also doing it for a more generalized evaluation where I've got different versions of these different elements. And what I'm doing is inside the template management system, I'll just show you guys real quick. If I go back, I go to settings, I go into manage templates. I think this is the main one that I've been playing with. I click edit. In here, I can play around with different things. So most recently this morning, what I did was I added a clinical justification section. Now it's not working as well as I want it to. I just need to do some refinement. But what I did in this, I said, please reference and use the following information from Medicare policy L34049, create a plan of care, provide clinical justification for coverage utilizing the following interventions. I listed my intervention, CPT code 97110, and then I copy and paste exactly what is in the Medicare guideline from CGS, which is my Medicare MAC. So it didn't really work quite as well as I wanted it to. I'll show you what that looks like real quick. I did this. If I scroll down to that section, it just kind of gives me this, a couple paragraphs. Again, just not doing it. This is probably the closest sentence here. It says the proposed physical therapy interventions, including therapeutic exercise, CPT code for restoring strength, endurance, range of motion, flexibility, neuromuscular reeducation, 97112 for improving balance and coordination. So that is a good sentence. Like it's referencing Medicare policy L34049. It's indicating the specific CPT codes and why I would be utilizing those CPT codes because strength deficiencies, endurance, range of motion, flexibility. Um, I like that part. The stuff above and below doesn't really add very much value. It did pull, objective findings from the audio transcription, but it's just not quite there yet. That's why we're all here. That's why we're trying to make this better. Uh, I will just continue to tinker and toy with this and figure it out. The better I understand the AI capability and how it's going to organize the information, the better I can deliver recommendations for you guys. Over the next 2 to 4 weeks, I imagine we will refine this to the point where a neurotherapist, a lymphedema therapist, a pelvic floor therapist, any of us can dial this in, because now we know where the knobs are. Like prior to this, we don't even know where the knobs are, how to turn the knobs. After we finish this, we'll figure it out. We'll know exactly what we need.